The Henry Ford Health System has a long history of improving healthcare quality for all patients. For the last 18 years, Henry Ford has played host to a Quality Expo, a platform for employees from throughout the system to be recognized for their work in developing clinical innovations and best practices. With 6 hospitals and 200 patient sites, the Quality Expo is the ideal opportunity to bring employees from across the system together and share their innovations and successes.
We think this is unique. We think this may be the largest display of quality improvement posters in the country inside of a healthcare organization. And it generates great staff enthusiasm. All departments want to have a competitor in this expo, and they spend all year figuring out, what's going to be a winner and what projects should we take on to best display our department.
This year, 91 storyboards from across the health system have been submitted, showcasing the dynamic improvements staff have achieved across a range of departments, but only 6 will be chosen as winners.
The Quality Expo is a fabulous platform to share our pursuing perfection work and indeed all the quality work that's being done in the system. We've achieved incredible success through our Perfect Depression Care initiative. The most notable response has been the elimination of suicide in a high-risk patient population. We have achieved 13 consecutive quarters in which there's been no suicide in our high-risk patient population. Now compare this number, 0, to an expected rate of about 230 per 100,000 in such a high-risk population. So a dramatic accomplishment, unparalleled, not previously achieved in the literature.
Another team showcasing their work at the Expo is the Trauma Department.
Here in the operating room, quality is vitally important. Again, because our outcomes are so visible and so measurable. The things we do to patients are terribly risky, so it's very important that we have strong quality measures and quality processes in this very risky, dangerous environment. The surgery program working on improvement is a multidisciplinary program. It involves surgeons, it involves nurses, it involves administrators, it involves anesthesiologists. It's everybody. This is a team approach, and it's the only way to be successful. We've got to share our data, share our processes, because we're all working for the patient.
One of this year's Expo winners is the Pathology and Lab Medicine Department, who've made huge gains through quality improvement.
Our culture is that of lean management. This has allowed us to be extremely effective. On this campus alone, we had 536 scientifically based process improvements last year. This laboratory behind you, we used to produce results for clinicians within the day by 6 o'clock the next morning in the electronic medical record. So anything tested in the system would be available by 6 a.m. We thought that was pretty good. Now, under lean management, a year later, 99% of those test results are available by midnight, not 6 a.m., and in fact 80% of them are available by 8 p.m. So we're constantly our own benchmark, and we're working things backwards, continually improving.
Dr. Carolyn Clancy is one of the leading improvement figures in the country and is just one example of the many prestigious speakers who have lectured at the Quality Expo.
The Quality Expo shows a real commitment to quality because people are taking the same general principles about defining the problem, assessing, and then trying to improve, rapid cycle, trying to figure out what works, seeing if we've actually gotten better, and so forth, but applying it in very diverse settings and celebrating with each other. The buzz here and the excitement is so palpable, it's almost hard to describe.
Other guests include healthcare purchasers who are able to see firsthand the system's commitment to quality improvement.
The benefit from the perspective of a purchaser is to see on the ground what truly can happen in the healthcare delivery system to drive improvement. Purchasers, as you know, are very, very focused on the cost of healthcare. It's a huge competitive burden. And in the manufacturing world, especially, understanding root causes for fixing and improving a very, very complex system is really where the payoff is.
The Henry Ford Health System was founded in 1915 with a commitment to improve the health and well-being of a diverse Michigan community. Nearly 100 years later, its mission and values continue to focus on quality and improvement. doing better tomorrow what they've already done well today.